So hello guys, in this video I am going to tell you how to read any chest X-ray. So let us see the ABCD approach towards chest X-ray. Hello everyone, in this video I am going to tell you how to read a chest X-ray. So this is X-ray chest taken in PA view. So first of all we should comment whether it is AP view or PA view. So how we should know it is AP or PA view? So in AP view you will see the heart larger, whereas in PA view it will be smaller, and in PA view the scapula will be posterolaterally, whereas in AP view it will be overlapping the lung fields. Also the ribs will be more horizontal in AP view. So we have to follow ABCD approach to read a X-ray. First of all, A for airway. So we have to see in the X-ray about the airway, whether the X-ray is hyper expanded or not. So you have to count the ribs, posterior end of the ribs, and the end of the rib just below the clavicle is the first posterior end of the rib. So this is the first end, first rib, second rib, third rib, fourth rib, fifth rib. So it is covering only 5 ribs. If it is covering more than 6 ribs, then it is hyper expanded. So this X-ray is not hyper expanded, and you can see this X-ray is also not rotated. You should see the trachea. Trachea is in the midline, and also the distance of clavicle is same. So this X-ray is not rotated. And for B, B stands for bones and soft tissues. So in this B, we can see the bones, whether there is any fracture in the ribs or clavicles, and soft tissue of neck also we can see in this, and also the vertebrae we can see. And for C is the cardiac. C stands for cardiac. So in this we have to see whether there is cardiomegaly or not. For that we use the CT ratio, that is the cardiothoracic ratio. How to measure the cardiothoracic ratio? We have to draw midline from this, midline like this, and we have to take the longest distance of the heart. This side you can take from here, and for this side you can take from here, and you have to add both of this. So this will give you the length of the heart. And for thoracic ratio we have to take one line from here to here, largest distance, and by taking cardiac thoracic ratio we can say whether it is cardiomegaly or not. So in infants, if it is more than 0.6 it is cardiomegaly, and in adults if it is more than 0.5 or 0.55 then it is a cardiomegaly. Then next point is the D. D is the diaphragm. We have to, in every X-ray we should look for the diaphragm. So there are two angles in diaphragm. This is the costophrenic angle, and this is the cardiophrenic angle. So this is not blunted here. We can see properly cardiophrenic angle and costophrenic angle is there. If this angle is blunted, then we can say that it is pleural effusion. And we have to also see the gas below the diaphragm. It is normal to have gas below the diaphragm on the left side, but if it is gas below the diaphragm on the right side, it is problematic. Then we have to see for E, that is exposure. We have already discussed exposure, whether it is good exposed or not. So this X-ray is good exposed, not rotated. And last, that is F, that is the lung fields. So we have to see the lung fields also. As we know that right lung has 3 lobes and left lung has 2 lobes. But on this X-ray we cannot see the lobes. So for that we have divided into zones, 3 zones. The first zone is up to the second rib. You can see that this is the second rib. So the lower border of second rib is the first zone. So this is zone 1. And from the second rib to fourth rib, it is the zone 2. That is the lower border of second rib. And below that is the zone 3. So we have to see whether there is any patch or not. So in this X-ray we can see the bronchoscular markings only. So as we have discussed earlier, there are 3 zones, zone 1, zone 2 and zone 3. So in zone 1 there will be peripheral and paratracheal. In zone 2 there will be parahilar and peripheral, and in zone 3 there will be paracardiac and peripheral. And usually the right dome of diaphragm is one space above the left dome of diaphragm. So this was all about the approach towards chest X-ray. Thank you.